5 o'clock. Till now, we have admitted 11 patients. 11 patients on oxygen. All of them are doing well.
Acha to that means which means do serious la do kumbi na COVID patient serious.
As of now, nobody is serious, thankfully. All of them are receiving oxygen, but they are stable.
Okay. To either COVID patients kan either kiman juna se idu kan do tahan do treatment do government ba pay kuyala sina tahan nijo pay kulela se do.
This is a paid facility, so but it is all subsidized. We have got support from the government, lot of support from the government, but it is a paid facility. Yet, even though we are a private hospital, if the patient needs, we will give charity. We will offer free treatment. If the patient needs, we will definitely give free treatment to the patient. Free treatment includes a free bed, free consultation, nursing care, and as well as oxygen, if it needs be. Because we will never turn a patient away just because he cannot afford treatment. That's for sure.
So which means like either needy manu kan kumba do sub manu same na theke to kumba do dukya manu theke to inikan aishe kule apne han modot kuroenga pa.
Yes, definitely. No person should be turned away just because of the socio-economic status. Because this is a war which all of us should be united. So definitely nobody will be turned back. Yeah.
All right. Aro to sir mo question aro ekta hudi ule mon jado idula third wave te like pregnant women kan bishi effect hwa aro like death tahan la hunya ba se. So like suppose like pregnant women kan aishe kule do idu do tahan karni idu third wave covid do tahan do bishi dangerous ase tahan nimide aro in case tahan any ye de treatment lo COVID-19 lagi na hishe ina hona tahan blood treatment do kina nishna ho like alak khan manuhan nishna ho na tahan do alak medication kan do alak theko tama.
See, you are talking about third wave. Yeah. Third wave will mostly affect
sorry, I mean second wave it has.
Yeah, second wave. So second wave, it can affect anybody. It need not be that pregnant ladies are at more risk or non-pregnant ladies are more risk. It can affect anybody, any socio-economic status. But yes, diabetics, heart patients, and patients with chest problems, smokers, they are at a much higher risk. Definitely, they will need an ICU care. But at the initial stages, everybody needs a oxygen bed or a non-oxygen bed and supportive care. When I say supportive care, it means physiotherapy, proning, laying prone, so that lungs get more oxygen. These simple things can make a big difference. And these people may not need ICU. That's why such centers are important.
Acha mui chanuli mun the pregnant women in case tan aishe admit hoishe do tahan la treatment do kina la type nishna ho.
Treatment will be same, but we will have a gynecologist on call, obstetrician gynecologist on call. In case something happens and she needs to deliver, definitely we will have a labor room facility as well as an operation theatre ready, so that she need not be going out in the middle of labor pains. Yes.
Okay, so bacha kan adults kan nishna COVID-19 like shegulu tahan symptoms to iki asena kina se.
Children will definitely behave differently from adults. Adults have all the stereotypical symptoms, but children may be asymptomatic. They may have diarrhea. They may have a common cold. It depends on the intensity and the severity of the disease. So children can be very variable. We cannot say that. But definitely, compared to adults, children can be unpredictable. But having said that, mortality, that's death in children, is very less as of now. But we don't know what will happen in third wave.
Okay, aro to idula COVID like do block te noholi ICU kan like VIPs kan garni like book specially book kurnan hoishikuli dahan garni rakhi dia like ko enasna na.
No, as of now, we have not differentiated between VIP or common. Everybody, we treat them the same because the disease has not spared anybody. So our main hospital is a separate facility. We as of now, we don't have an ICU facility. So what we are offering is oxygen beds and non-oxygen beds, whether it's VIP or non-VIP. It's the same facility.
Mula next question COVID patients can mild symptoms sakshe. Ina hoishuglu tahan korba recover grow parona na.
Definitely. Mild symptoms. When you say mild symptoms means no breathing difficulty, no diarrhea, just some mild fever, body aches. Definitely they should stay isolated in their house, wash their hands whenever they touch anything, don't go out, take medication from the hospital or COVID center where they were tested, and an isolation period about 14 weeks is enough. They will recover. But during this period, if they feel breathless or if they start having lot of diarrhea or high fever, they should report back to the COVID center.
So apne hospital de manukan alak hospital compare kuishugule dan facilities kan ki manuhan alak jaga de na thakia lagia de ki alak dia se ki offer gure se.
We are a private hospital, but yet what facilities we offer in this COVID center is that we've developed, we put together a dedicated team of doctors, nurses who are dedicated to COVID care. Also, we have a pastoral care and a physiotherapy on call, who will also look after the. We are aiming to give holistic care rather than only focusing on COVID care, because COVID also affects many people mentally. So we aim to treat and give holistic care mentally, spiritually, as well as medically. That's what I feel is different in this center.
So idia patients can admit guna thagya khandu tahan idu tahan la khana khandu food khandu tahan do kunbra dia se apne an na tahan nijor bra ginina khas tam.
We give a choice whether they want to bring from home. Many people find it difficult to bring from home, so we have offered subsidized food, pork, chicken, vegetarian, everything is available here at a subsidized price. Plated meals, tea, coffee, everything bedside is available.
Acha aro mu hudu mu to COVID-19 do like manhan ko si do 5G karni bi ase na kibek ta na huni ase to abnila idu abni de yadi didula de ki ko.
These are nice conspiracy theories, no? These are called conspiracy theories. So there's nothing like that. The telecom department has also issued a notice that it is not because of 5G. It is definitely because of a virus which we can't see, yet it is a mutant virus. So let's be careful and let's mask ourselves and stay home and stay safe. Yeah.
All right, Aro, what are the most common myths and misconceptions about COVID-19?
Most common misconception of COVID is that I won't be affected. So that's very, very dangerous. Also, when we are sitting with relatives and friends, we always take off our masks because we think, oh, it's my friend, it's my relative. That's another misconception. Even if you are with friends, even if you are with relatives, you should always wear a mask and always wash hands after going out. COVID is curable, but there should be no stigma attached to it. Let's not think that COVID means we are ostracized or stigmatized. We should go to a health clinic, get tested, isolate ourselves, and it's cured. After all, it's just a flu. It's just a common cold, but slightly mutant and slightly more dangerous.
All right, Aro, apni kwa nishna idu general question ase hulibi there has been a rumor like idu medical staffs can shortage la face wala la sob la jaga dena medical naglinde inega huni ase to how far it is true apni bi kushe idu enough no hoina to idu la borde aro ki et to mujo aro.
Definitely we are pulled out to the limits because of staffing, because many people are afraid to work, but our staff are motivated. We have a roster system already put up for the next 2 months for staff to work. So I would say we are okay with the staffing we have. Yet, yes, we will welcome volunteers who would want to come here, maybe send some food for the patients, cook home cooked food, fruits or something. Definitely we'll appreciate and accept volunteers who would want to help out, whatever it may be, that's the way it is.
So, alak hospital de amhan dikya nishna kumban do volunteers crew le manuhan la iduhan la advertisement kan bi ula nishna ina dikya se to Olive Hospital la idu la di do inahan ideas kan ego ina steps kan utai gina sena nai so far.
Yeah, we have not taken any advertisement because we've just opened yesterday evening. As of now, we don't have a dearth of staffing, but many people have contacted us, whether our good neighbors, the community, the village council, they contacted us already whether you want volunteers. But through you, I would definitely say if anybody wants to give any bit of their work, their time or anything, definitely is welcome. Yeah.
All right. Aro ija COVID-19 huwa gani manuhan bishi panic hwase aro bishi bhoi bra bhuase so apni manuhan ke idu la upor de apni ki komun jase. Would you like to say something?
I would say not to be afraid, but yet be safe and stay home. Don't go unnecessarily outside. Always wash your hands. Mask, wear any mask. If you're wearing a normal mask, double mask. And when you're sitting with friends, when you're sitting with family, if you're not eating, wear a mask. It's okay. Others might feel bad, but it's okay. It's better to be safe than sorry later. Yeah. And don't feel stigmatized or afraid to go to a clinic to get tested. It's just a virus. It'll go.
So, amen. Ita idu question to khatam hoise uli amen wapas studio de jao do studio de ra ko questions kan hudule asena na doctor ke ami ke chanai dibi.
Yeah, Renjimi. Udo tahan kaliwa start korishe ko aso udo COVID khan karne na to coming days se tahan kiman prepared ase bishi patients han thakile tahan kiman prepared ase udo face ko le na.
Okay. तो हामी स्टुडियो रा क्वेश्चन्स गर्न हेर्छ सर तो अपनी कन्डिसन काली रा खुली से गुसे तो in future aro kali person kan in case covid patients kan bishi hoise na bishi aise to apni kan idu karni prepare asana na
We are very well prepared. If this facility fills up, we will put up more facilities. If the need be, definitely we will open up rooms inside also. We will not hold back rooms. We are ready for that. Yeah.
And then
any more question
another to ekta do bed occupancy kiman ase tahan aro oxygen cylinders han asan nai covid patients kan kiman ase
okay covid patients kan karni oxygen kan kiman ase aro occupants kiman ase ko ase ja
All our 40 beds have oxygen supply. As of now, we have 11 beds, 11 patients who are on oxygen need. All of them need oxygen, out of which one patient is not so well, but rest of them are well.
aro occupants kan do kiman nishna ija available beds kan aro kiman ase
We have total 40 beds,
40 beds,
out of which 11 are occupied. So 29 are available.
okay
Yeah. 29 are available.
to ita tan hospital bana do
back to you lishni
yes ita tan hospital bana do covid han bi konishna kali 11 patients kali was start kore 11 patients kan nishna admit kornes na so tan kinga handle krase to covid na hwala patients kan bi tan covid na hwala patients kan bi thaga do tan kinga handle krase du duita do aru staff han kiman ase kinga tan meet krase to so patients hala needs hando na
sir abdian edu covid-19 patients kan chari gina alag patients kan bi ase to idu kan do kina idu han sadam de tahan gi do kina ga handle kore ase
We have a separate team of doctors who are handling the non-COVID hospital, which is the main hospital. We have a separate team handling the COVID hospital, which is the COVID isolation block. The nursing care is separate, and the food supply is separate, and the physiotherapy, the pastoral care, everything is separate. So we want to make the main hospital a non-COVID hospital, because non-COVID patients also have needs. They also need to be treated, you know. So as of now, we have 90% occupancy of the non-COVID hospital, and we just started this yesterday, and only 29 beds are still vacant. Yeah.
aro mo ide add korli mun jawa tahan idu olive hospital do tahan la under premises idu under de tahan idu covid-19 block to ide tan hospital la olop age jagna idu la hospital la premises je holibi hospital la osor de no olop idu la area fali olop banai na se tan idu special alak
patients
back to you lishni
patients on 11 kaliwa start hoise and inga hone alag patients kan be ase to alag patients an do kiman nishna ase and then tan ite vaccination lado ite bishi jai ase nagaland devi vaccination drive lado to tan hospital ba eko vaccination drive han initiative ne kurishna nai aro kurishe kule do kiman jon aine vaccine tan hospital olive hospital ba luise
all right sir aro alakan covid-19 patients kan hoina alakan ija kiman jun nishna alak patients kan do kiman nishna thago alag
Non-COVID patients. COVID patients, as of now, we have about 11. Non-COVID patients, we have about 49 patients admitted as of now under different specialties like medicine, urology, surgery, pediatrics, dermatology. So that's about 49 or 48 patients are admitted as of now. Yeah, in the main block, which is a non-COVID block.
All right, Jado, we all know that vaccination drive to stop jagah de jase to apne hami hospital olive hospital de idula vaccination drive karni dia shuru hoiche na the hospital under
We have not taken the vaccination because the vaccination center is just in Difupar Council area, no? So it's just nearby. That's why we have not taken the vaccination center.
okay
okay to imani ho questions karne thank you sir thank you Dr. Hemant Prasad for joining Hornbill TV Itia Dr. Ba Kwanishna Ita Dr. Ba Kwanishna kaliwa start kone tahan khali